There's 2 and 3. There's 4.
Hi. Today I'm going to talk about the benefits of having gastric bypass surgery and persuade you that people that are obese or actually morbidly obese or super obese should have this surgery. Over a year ago, I weighed over 330 pounds and I had the Roux-en-Y gastric bypass surgery. This is a picture of me then. This is me now. I've lost over 120 pounds so far, and the gastric bypass is very ideal for people that have a BMI of at least 35 and comorbidities like diabetes or some kind of insulin problems or heart conditions and stuff like that. And according to the Pregnancy and Fertility Following Bariatric Surgery, a systematic review by Maggard, Yermolov, Magalone, Newberry, Stirrup, and Hilton, and Morton and Lemison and Skeckel, they say that women who have the gastric bypass surgery become more fertile after they have this surgery, which is one of the reasons why it was really important for me to have it. Also, there are people that decide that they don't want this surgery because they feel like it's too risky from having like problems with surgery post-op, and maybe they are afraid they're going to lose their life during surgery, and they just don't want to take that chance. But it's really important because if you do take that chance, you're actually gaining life and you're extending your life. Health is one of the most important reasons why somebody should consider having this surgery, and making your fertility is another one, and then also building your confidence up. Confidence, to me, was a big one as well. I'm going to start off with explaining to you and presenting you some ideas about the gastric bypass surgery. People with type 2 diabetes usually after surgery recover without having to take any more medicines at all. Usually the day of their surgery, like me, I was told not to take my medicines anymore, and I haven't taken them since then. Also, it helps with preventing like premature strokes and any kind of cardiovascular problems. According to the bariatric surgery cure for diabetics, blood glucose levels sink to normal levels within days by Catherine Hobson. It really explains to you how a person's blood sugar levels can go back to normal after this bariatric surgery. Also, according to the Endocrine Society, weight loss after surgery, gastric bypass surgery may protect against infection and cancer. By the News Rx Health and Science, they say that your immune system actually becomes stronger because the more weight you have on it, the more that your immune system is weakened, and you can actually become more prone to cancers, which I found very interesting. I'm going to move on to the topic of infertility. Women that have they've done studies that in the past 10 years, women that have had this gastric bypass surgery really increase their fertility a tremendous amount. Usually women that carry a lot of abdominal weight have infertility issues, and these are the ones that you see that are very morbidly obese and super obese kind of people. Also, after the gastric bypass surgery, they usually ask you to wait about 18 months because during the 18 months is when you lose the most surgery weight, and then also it helps with any kind of vomiting and nausea because usually you can't tolerate a whole lot of stuff during those first 18 months, and when you have cravings for stuff, then it kind of counterbalances things. And so you actually, once you do become pregnant, you have to slow down your eating processes, you actually start eating more carbs and stuff to kind of slow down the weight loss, because it helps you gain weight for the baby and prepare to have that child. Also, I wanted to explain to you that after you have the surgery, that not only are you gaining better health, you're becoming more fertile. This is for women, but you also gain a lot more confidence about yourself. Personally speaking, after I lost a lot of weight, I started noticing that maybe in the first month that I had lost about 20 or 30 pounds, and that my clothes were a lot looser. It made me feel a lot more confident about going out in public and being around people, and not having to worry if I have to get an extra seatbelt on the airplane to take an airplane ride, or to be able to go to the roller coaster and be able to get on a roller coaster ride without having to be squished in, or even being allowed to get on one. I kind of had the walk of shame when I tried to get on one of those lift rides where they come and bring something down over you and it didn't fit me, and I actually had to walk away from the ride because they couldn't get the seat down on me. So that was a big deciding factor for me too. And it just, knowing that I can move easier now and just move more freely really helps out building my confidence level. The surgery very much changes your life. It changes your health, your attitude, your outlooks on things, and really, all in all, is very, very beneficial for you. I can't stress enough how much the health has really improved. My health has really improved over the past year. I've noticed that my skin is a lot clearer, that I feel a lot better about everything, and I just wanted to tell you one thing, that if I ever had to do this again, I would do it in a heartbeat, and that this surgery is only a tool, and it's used as a tool to help you. You have to make that decision to use that tool and make it work for you. There are people that don't use it and abuse what's been given to them and keep the weight on. But if you take it off, you feel so much better about yourself, and it's so much more worthwhile. And I really believe that if you have this surgery, or you convince somebody that you know is very obese or super obese to have this surgery, their life will change dramatically. I hope that you've enjoyed the information that I've given you, and that this has persuaded you to go out and help somebody or help yourself. Thanks.